بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه وسلم أجمعين. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا يا كريم. Dear colleagues, this is the last part of the topic skeletal fractures. We have finished the fractures of the upper limb, and then we discussed the part of the lower limb fractures, including the pelvic fractures. Then this is the last part of this topic, which will discuss the fractures from the level of the knee down to the foot. And starting by the knee, we have first the dislocations of the knee joint. There are many types of knee joint dislocation depending on the direction of the displacement of the tibia. If the tibia is displaced anteriorly, and this is anterior dislocation, if posteriorly, and this is posterior dislocation, and you may have some multi-directional displacement, meaning that the tibia may be displaced posteriorly and medially or anteriorly and laterally and so on. This, of course, is the result of a severe type of trauma, and it may affect the patella, which is usually dislocated, and a lot of soft tissue injuries will happen inside the knee joint, especially the rupture of the anterior cruciate ligament. Also, the dislocation of the knee will affect the vessels in the popliteal fossa, especially the popliteal artery, and the injury will depend on the direction of the dislocation. Since anterior dislocation of the tibia will result in a stretching of the popliteal artery along the posterior aspect of the femur with concomitant internal injury and maybe dissection of the artery, while posterior dislocation of the knee commonly will result in rupture of or transection of the popliteal artery. And these are the complications of knee joint dislocation, including neurovascular injury. Of course, many of the ligaments in the knee will be injured. Some sort of stiffness and arthrosis of the joint will follow the associated cartilaginous damage. This is, of course, an anterior dislocation of the knee joint with anterior displacement of the tibia and the dislocation of the patella. And this is what we call rotatory knee dislocation. You see, the tibia is somewhat dislocated posteriorly, and also it is dislocated laterally in relation to the shaft of the femur. And you can see this air fluid level inside the joint, indicating that there is some air and fat and blood within the joint itself. And we came to the patellar fractures, and this is one of the common fractures around the knee. And the patient usually presents by a swelling and pain in the region of the patella. There are many types of patellar fractures. The most common one is the transverse fracture affecting the mid part of the patella. Comminuted fracture, vertical fracture is rare. Osteochondral defects in the course of osteoarthritis or traumatic damage of the articular cartilage, or what's known as patellar sleeve fractures in the children. The patellar fractures are usually caused by direct blow to the patella, like the dashboard injury in car accidents, severe forces by extension mechanism, sometimes after ACL reconstruction and after total knee replacement, or in a few conditions, the fracture may be pathologic due to involvement of the patella by, let's say, bone tumor, for example, which may result in this pathologic fracture. The complications of patellar fracture include stiffness, joint stiffness, hemarthrosis, patellofemoral osteoarthritis, and reduced knee extensor mechanism. The treatment is by cast for the non-displaced fractures, or sometimes by wiring of the fractures. And this is an example by plain X-ray and reconstructed CT images showing a comminuted fracture of the patella. You see the fragments in the sagittal and the 3D images. By MRI, you see a transverse patellar fracture. The lower fracture fragment shows some bone marrow edema in the form of low signal in the T1 and high signal in this stair image. And you see also soft tissue edema along the patellar tendon and a small amount of joint effusion as well. And we came to the fractures affecting the tibial plateau, and these are usually the result of varus or valgus forces combined with axial load. So they are commonly known as bumpers fractures because they, uh, if one is standing on the land and is hit by a car, then there is an axial load, and according to the direction of injury, there may be a varus or valgus injury. Then you may got one of the types of fractures of the patellar of the tibial plateau, which clinically present by hemarthrosis, instability, and sometimes the neurovascular injury. And we have about 6 types of patellar of tibial plateau fractures, and these will include the type 1, which is a, a fracture of the lateral tibial plateau without depression, and the type 2 involves the fracture with some depression. Type 3, there is the breast fracture of the tibial plateau along the articular surface. Type 4 is an almost Y-shaped fracture affecting the region of the tibial spine and extending into the metaphysis. Type 5 involves the lateral as well as the medial aspects of the tibial plateau, and type 6 involves as well the metaphysis of the tibia. Then the complications of tibial plateau fractures include the compartment syndrome I have mentioned in the introduction for the fractures, which commonly involve the tibialis anterior muscle, joint stiffness, deformity, and osteoarthritis of the knee joint. And this is an example of type 1 tibial plateau fracture affecting the lateral aspect of the tibial plateau in this 2D and 3D reformatted images. This is also an example of type 2 tibial plateau fracture with depression of the articular surface together with the fracture of the lateral aspect of the tibia. And this is type 4, and you may be able to appreciate the configuration of the Y-shaped fracture involving the region of the tibial spines and extending into the metaphysis of the tibia. And this is type 6, where you got a comminution of the lateral aspect of the tibial plateau together with metaphyseal extension of the fracture. And also you may appreciate the comminuted fracture of the proximal part of the fibula, which is not a part of this classification. And fractures of the tibial shaft are almost similar to the fractures of the femoral shaft, for example, or fractures of the humeral shaft. These are usually due to direct trauma, which may result in transverse or comminuted fractures. Indirect forces may result in spiral or oblique fractures. And you remember that the trauma for the leg may result in this compartment syndrome, which usually involves the tibialis anterior muscle. And about the distal third fractures are sometimes associated with non-union or union problems. The complications, as I have mentioned, the compartment syndrome, malunion with shortening and arthrosis, osteoarthritis, I mean, and sometimes non-union. This is just an example of a spiral fracture in the tibial shaft by plain X-ray in the frontal and lateral view. This is a non-displaced simple fracture of the shaft of the tibia. Then we proceed to the fractures around the ankle joint, and these fractures are usually classified according to the Weber classification, which stated that the fractures are three types: Weber A, B, and C, and the site or the uh, yes, the site of the fracture in the fibula determines the type of the fracture. If the fracture of the fibula is below the tibiofibular syndesmosis, and you remember in the lecture of the ankle, I have mentioned that there are two types of ligaments along the lateral aspect of the ankle. The first one is the lateral collateral ligament, and the second one, which is slightly above, is the tibiofibular syndesmotic complex. And if the fracture is below the level of the tibiofibular syndesmosis, and this is type Weber type A, if it occurs at the level of the syndesmosis, and this is type B, if above the syndesmosis, and this is type C. And you can appreciate these fractures from this very short video presentation for the the ankle fractures. As I have mentioned, they are classified according to Weber classification. You have type A, type B, and type C. And this is in relation to the tibiofibular syndesmosis. You can see the mechanism of injury, which will involve the distal part of the fibula, and you see here at the level of syndesmosis there is a fracture. And remember that in many situations there is the fracture of the lateral of the medial malleolus as well, and this is the Weber type C, where you can see the fracture above syndesmosis, which is usually rupture and the associated injury. Then we continue the fractures around the ankle, and this is type A, Weber type A fracture below the level of the syndesmosis. And you remember the mechanism of injury, and you see the direction of trauma like this, and many times the medial malleolus is ruptured as well. And this is an example of Weber type A. You see the fracture of the distal part of the fibula below the level of the syndesmosis, and this in this particular example you can see that the medial malleolus is intact. The second type, you see the direction of trauma is from medial to lateral. there is fracture at the level of the tibiofibular syndesmosis, and also you may see fracture of the medial malleolus. And this is Weber type B fracture. You see the level of the fracture line in the fibula at the level of the tibiofibular syndesmosis with fracture of the medial malleolus. And this is also a type 2, a type B fracture of the fibula with intact medial malleolus. And this is Weber type C, where you can see the fracture above the level of the syndesmosis. This is a good example for fibular fracture, distal fibular fracture above the level of the syndesmosis. And this is what we call trimalleolar fracture, where you got comminuted fracture of the distal fibula at the level of syndesmosis. This is considered Weber type B, with fracture of the medial malleolus as well as fracture of the posterior malleolus of the tibia. And also this is a trimalleolar fracture, fracture of the distal part of the fibula, then fracture of the medial malleolus, and in the lateral view you can appreciate the fracture of the posterior aspect of the tibia, which is known as the posterior malleolus. This is the usual way of fixation of these types of fractures in you see before and after internal fixation. Complications of the fractures around the ankle will include the dislocation and subluxation of the ankle joint, stiffness and osteoarthritis, some sort of ankle instability, non-union and malunion of these fractures. And finally, we came to the fractures affecting the foot, and we have this Les France injury, the Chopard injury, avulsion fractures, snowboarders fracture, Jones fracture, calcanean fractures, and finally the stress fractures. We start by this Les France injury, which involves the ligament located between the first and the second metatarsal bones. And this will result, as you can see from these drawings, in widening of the space between the first and the second metatarsal bones. And this injury can be diagnosed easily from the plain X-ray. When you draw a line along the medial margin of the second metatarsal and the middle cuneiform bone, this line will be smooth in normal conditions. Then this is the second metatarsal bone. This is the middle cuneiform bone. If you draw a line like this, and it will form a very smooth curve. But in case of injury of this ligament in between the first and second metatarsals, then the line will be like this. Then this is the site of the ligament between the first and the second metatarsal bone, and this is the middle or the intermediate cuneiform bone. And you can, from the plain film, you can diagnose this type of injury. Then you came to the second type of injury, which is known as Chopard injury, affects the metatarsal joint of the foot. And this will result in dislocation of the talonavicular and the calcaneocuboid joints. It's important to know that this type of injury is well appreciated in the lateral x-rays of the foot more than the frontal and oblique x-rays. It is usually the result of high injury impact trauma to the foot with dislocation of these joints, and sometimes fractures of the calcaneus, the cuboid, and the navicular bones. What is important in this type of the fracture in that the talus remains in the ankle morts intact. It maintains its normal relation to the tibia. Then look carefully for this frontal view, normal frontal view of the foot, and this is the injury. This is the normal oblique view, and this is the oblique view of the injury. If you want to predict this type of injury, look to the relation between the talus and the navicular bone. Yeah, this is the talus and this is the navicular bone in a normal condition. And here you cannot appreciate this relation because this joint has been dislocated. Also, in the oblique view, you may be able to see the normal articulation between the talus and navicular, the calcaneus and the cuboid. These two joints are dislocated in this type of injury. In the oblique view, this means you cannot appreciate this normal appearance. But in the lateral view, this is the normal appearance and this is the injury where you got the dislocation of the talonavicular and calcaneocuboid joints. And in the CT images, of course, the sagittal reformatted images are of good help in the diagnosis. You see, this is the talus and the talonavicular joint normal. And this is the talus and the talonavicular joint is dislocated. You should remember that the talus maintains its normal relation to the tibia. Then fractures of the fifth metatarsal bone, especially where this metatarsal has many types of fractures. The first one is a Vulcan fracture of its proximal segment, and then the second is the Jones fracture, which is immediately above this avulsion fracture. Then you got the stress fracture, and you got the finally fracture of the shaft. And we have to discriminate in young persons the difference between the fracture and the non-united apophysis. The fracture is usually transverse in orientation, while the apophysis line is obliquely oriented. And this fracture is sometimes known as the tennis fracture because it results from avulsion of this part uh, uh, of the uh, of the proximal fifth metatarsal bone, and it usually involves the tarsometatarsal joint, and sometimes you see this in tennis players, and you remember that this fracture is of a relatively good prognosis compared to other fractures affecting this particular type of the bone. I think this very short video can can let you know why this type of the fracture is known as the tennis fracture. Once more, you can see this how this injury occurred. Look to this foot, how it is injured by this during this motion, and this is the cause that they usually say that this is a tennis fracture. Then we continue, and you see avulsion fracture of the proximal part of the fifth metatarsal bone, which may extend to involve the articular surface between the tarsal and the tarsal bone and the metatarsal. Because the Jones fracture is a little bit above this site of injury, it is sometimes known as pseudo-Jones fracture or tennis or dancer fracture in certain occasions. And this is a Vulcan fracture of the proximal part of the fifth metatarsal bone. Then this fracture is of a little bit bad prognosis with high risk of non-union. It is located above the site of the Jones fracture and above the site of the avulsion fracture of the metatarsal bone. Simply, if you see this, which looks like a triangle, if you draw a line like this to form a triangle, then this is the site of the avulsion injury. Above this triangle, the fracture is known as Jones fracture. Then here you can see that the site of the Jones fracture, and this fracture, according to the literature, is of relative bad prognosis due to the high risk of non-union. And this type of diffraction, which involves the lateral Taylor process, is also known as the snow borders fractures because it is usually seen in the snow borders during this particular type of, of motion. Then there may be an injury to the lateral process of the talus, which is of course better seen and the reconstructed CT images more than in the plain X-rays. Then this is the mechanism of the injury when the foot is dorsiflexed and inverted, as happens in the snowboarders. This is the fibula, this is the tibia, and this is the talus, and this is the lateral process of the talus, which is fractured. Sometimes you may appreciate this fracture in the plain X-rays, but it is well appreciated in the CT scan, especially in the reconstructed images. Calcaneal fractures are considered the most common fractures of the tarsal bones, and they represent about 2% of all fractures and about 60% of the tarsal bone fractures. As in any fracture near to a joint, the fracture is classified into two main broad categories. The intra-articular fracture, which involves the articular surface, or extra-articular fracture, which do not involve the articular surface. Sometimes the fractures of the calcaneus are known as lovers fractures or Casanova fractures, since many of these fractures occurred whenever one is jumped from a higher from height and fall on his ankles, then you got comminuted fractures of the calcaneus. Then for the diagnosis of calcanean fractures, there are many angles for this, and this is one of them. You draw a line along the two highermost points of the surface of the calcaneus against the talus, and you draw a line along the posterior surface of the calcaneus. Then you measure the angle between both, and this angle is is from 20 to 40 degrees. If the calcaneus is fractured, then you got narrowing of this angle because of the flattening of the calcaneus. And this is in the other angle, you measure the angle between the two articular surfaces of the calcaneus against the talus, and this angle is usually in the range between 95 and 105 degrees. If the calcaneus is fractured, then you got flattening and more widening of this angle, which in many times is greater than 130 degrees. And this is an example of a normal polar angle, and this is the angle which is reduced uh, because of a comminuted calcanean fracture. And this is bilateral calcanean fracture in a young male who jumped from a height and landed on his feet. And you got multiple comminuted fractures. As stated in the literature, the name lover's fracture is derived from the fact that a lover may jump from a great height while trying to escape from the lover's espousee. Then you got flattening of the superior surface of the calcaneus, and of course, calcanean fractures can be also well appreciated by MRI, and you may be able to see the fracture line in the T1 weighted images, and in the T2 and STIR images, you can see the degree of the surrounding bone marrow edema. Calcaneus is also one of the sites for stress fractures, and this fracture is difficult to be appreciated in the plain X-ray. You may see just a dense line in the back of the calcaneus, as you can see here, but it is well documented by the bone scan, and of course MRI is the best way for demonstration of these types of stress fractures. This is a complicated classification of fractures of the calcaneus, and I put it here for anyone who wants to go for more details of the calcanean fractures. And in my opinion, if you are in the casualty room and you are, or in the casualty department, you are responsible for interpretation of the radiological examinations, and you have to mention only that there is a comminuted fracture in the calcaneus, and the fracture involves the articular surface, and you may say that it involves the lateral articular facet. You know that this is the sustentaculum villi, and it points medially, and this is the lateral surface of the calcaneus, and this is the central part, and this is the medial surface of the calcaneus. And finally, the stress fractures affects commonly in the foot, the second and the third metatarsal shaft. And it can also be seen in the calcaneus, as I have mentioned in a moment, as well as in the base of the fifth metatarsal bone. Stress fractures are usually micro fractures, and they are discovered by plain X-ray if they are surrounded by a good amount of callus formation, as we can see in many examples. Then you may not be able to see the fracture itself, but you can know the site of the fracture by the presence of this significant callus formation at the site of the fracture, and you know that this site as well as the third one are common sites for stress fractures in the foot. Alhamdulillah Rabbil Alameen. Thank you very much.